When a practice begins screening their school-age and adolescent population for social-emotional issues, there will be times that a screen is positive, but may not indicate a referral. One way to address concerns in primary care is to use the common factors approach. Common factors, or HELP, are family-centered techniques that use common skills present in a number of evidence-based interventions and can be used with all ages. Common factors has been shown to be effective in reducing parental distress and increasing the child's functioning across a range of mental health concerns. In this next scenario, we'll look at an example of a grandparent concerned about her grandchild's sleep patterns and how the provider addresses her concerns.
Jessie, your exam was completely normal and healthy, so that's great. Mrs. Taylor, I also did want to follow up on the PSC that you had filled out earlier. It appeared that you had some concerns about Jessie's sleep. Jessie, could you tell me a little bit more about how you sleep at night?
Everything's fine. Grandma's just nagging me about being on my iPad at night.
You're on that iPad until all hours of the night. Then I try and get you up in the morning and you won't have it. I'm not putting up with your moodiness anymore because you just won't go to sleep.
Now, Mrs. Taylor, this sounds like a pretty big concern for you, and certainly sleep is very important. I wonder at this point if I could speak with Jessie alone for a bit. Would that be okay? Would that be okay with you, Jessie? All right. Mrs. Taylor, why don't you follow me?
High school kind of sucks. Grandma doesn't understand how hard it is. I have so much to do during the day and it stresses me out.
Sounds like school kind of sucks right now.
Yeah.
Tell me more about that.
I can't sleep at night thinking about the next day. So I stay up a little later on my iPad talking to my friends. It's the only thing that helps me chill out.
You know, Jessie, it sounds like you have a lot on your plate. And to be honest, I'm really impressed with how well you've been coping so far. That's really important. I wonder, though, if there's a way that we can find to keep school important to you, but also help you to enjoy it more by getting rest at night. What if we brought your grandmother back in, shared with her a little bit more about your stress, and maybe together we can find a plan to do that? Does that sound okay?
Sure.
Now, do you want to fill her in, or do you want me to do that?
You can.
Okay, let me go grab her. So Mrs. Taylor, Jessie and I have been talking about the sleep issue a little bit, and I think one really important thing that she shared with me is that she's been really feeling stressed recently. And I think one way she's found to cope with that is by staying up late at night. I think it's important to cope, certainly, but she recognizes, as well as you and I, that staying up late at night also leads to sleepy mornings. We brought you back to maybe together think about ways to cope and de-stress without leading to those sleepy mornings. Now, Jessie, what do you think you need each night to de-stress and relax?
I need like 1 hour after school to kind of chill out.
That sounds pretty reasonable. Now, what would you do during that hour, you think?
I don't know. That's why I usually get on my iPad.
So maybe even you can spend an hour on the iPad each evening and de-stress and relax, and then when you're ready to go to sleep, you're just free to do that and get a good night's rest. Does that sound reasonable? Mm-hmm. Now, Mrs. Taylor, what do you think about that?
That'll be fine with me as long as everything's off by 10 p.m.
That sounds very reasonable. Now, do you guys have any other ideas about de-stressing and relaxing, something you might even be able to do together?
Well, I mean, we used to take walks, which kind of helped me get my mind off of school. We could do that again.
That would be really nice, Jessie. I could use a walk myself after a long day at work.
That sounds like a great idea.
You can see how the physician used common factors to address the issues of sleep and school stress with Jessie and her grandmother. He gave them hope by setting realistic expectations for de-stressing after school each day. He showed empathy by listening to Jessie and understanding that school demands are stressful. The physician used Jessie's language to describe her current situation and how she was feeling about school. He expressed loyalty by being committed to the family to help them through this situation. He asked permission to bring Jessie's grandmother back in the room to discuss a plan. He then partnered with the family to find something that could be agreed on by both parties and created a plan to take the first steps to improve the situation. Although Jessie's score on the risk assessment tool was positive, it was clear that the relationship the physician had with this family and the use of this technique was more appropriate than referring out to a mental health provider. The physician can also bring Jessie back in a few months to follow up on their conversation and check in on her stress level.